Okay, back with you on the Bronx Buzz. I'm thrilled because we are going to one of the most important institutions in the Bronx, and that is Jacobi Medical Center. Before we go there, just want to mention there's a time change of this program. We had been on Thursday nights, but now beginning March 1st, we're going to be on Friday nights at 6:30. So you can catch us on the BronxNet TV, on the stream, and of course on YouTube as well. But right now we are at the Jacobi Medical Center. Let's say hello to Nicholas Hughes, who's the Wellness Program Coordinator at New York Health and Hospitals, Jacobi. Nice to see you, Nick. Thanks for joining us.
I appreciate you inviting me on.
Well, we've got a full house. Monica Moreno is the Director of Programming for Arts and Medicine at Health and Hospitals Corporation. Nice to see you, Monica. Thanks for joining us. And we're talking about a mural, so we've got to have an artist, and that is Ebony Bolt, who's the artist of the mural that both she and Monica are kind of displaying some of that work in the background. Nick, let's just start with you. Why is this good? Why is this important to have at Jacobi Medical Center? And basically, we're talking about a mural that has been created, and they cut the ribbon in December.
Well, as somebody who's been an employee here for about a decade, I've seen that. I think us as workers have always wanted kind of a communal space. Things have kind of changed, especially post-pandemic. It was kind of always harder to find a space to kind of sit together with everybody being together to be able to kind of talk, chat, eat. We would always spend most of our time like doing it in the offices or in places where you probably really shouldn't eat.
I won't tell. That's okay. That'll be our secret. But the point is, it's a matter of staff and also people and the general public, patients or whomever is coming through the hospital. What impact has it had? Is it a measurable impact, or it's one of those things that it's there and you start to say, "Wow, we're getting, kind of a nice social setting that we never had before"?
Well, I think you could see the impact even as it was kind of being made, even from the process, because I was involved in kind of the building of it, working with like staff and some of the patients and selecting colors, selecting, what we were going to do, working with Ebony. So it started there, but then as you saw Ebony kind of add to it, and as the folks were kind of starting to change the space, you could see it immediately. People would stop, conversations would be had there. I remember joking with Ebony as she was working on the mural that like it was hard for her to kind of continue to work on it because so many people were just interested in what she was doing, and you could tell that they felt different walking through that area. So it was
And
cool.
clearly, the notion of community and creating a community. Listen, I'm not a doctor, but all those kinds of things help people's health when they feel like they're being comforted, when they feel like they know the people around there. The benefits are extraordinary. Monica, this is the part of the Community Mural Project. I noted that it was believed to be the country's largest public hospital mural program since the 1930s. And I'll just give the facts. 7 new murals created this year across the health system, 43 murals created at NYC HHC since 2019. Why is HHC so behind this, and why is it so important to all our public hospitals?
Art in our spaces provides a healing environment. It is shown through evidence and research that art helps to reduce anxiety. It helps us to be more present, and it helps with healing. So it reduces time in the hospital. So we work with the generosity of the Illumination Fund, the Laurie M. Tisch Illumination Fund, to create these murals. And you mentioned the name, which is the Community Mural Program. And community is the key. We do it, as Nicholas said, we start with the artist and community members to share what do they want to show in the mural, and then we have a really fun and joyous paint party where everybody gets to contribute. And what was special about this one, in addition, Ebony continued to work on it. Because it's huge, it takes up an entire room. She was able to work on it here on site. And I do love that you asked about impact, and that's something that we're really interested in, as is the many people, as are many people. We are part of the Hospital Mural Evaluation Global Research Project that's being done by the Jameel Arts and Health Lab at NYU in partnership with the WHO and Culture Runners. And it is to measure the impact that these murals have on everybody within the hospital community. And if it does help to create a sense of belonging, which we very much think it does.
You really buried, to me, you know, like a journalist, you buried the lead when you said it shortens hospital stays. And that is obviously what you're talking about, doing that analysis. That to me is an extraordinary thing. Now, we're just talking extraneously about the mural. Monica is sitting in front of the actual mural, right? We have a picture of the mural, which we're going to show. And Ebony, let's just talk about the concept and who created it. And I know it wasn't only you. Talk about all the people involved in it, and maybe Anderson, and show pictures of it as well.
Thank you, Gary. This was such a great process and eye-opening, because having not just the arts and medicine program embrace me, but the staff at Jacobi, and putting on the focus groups to get feedback from staff and patients to understand what they were looking for in a community mural. So my background is drawing people. I love to draw people on trains, buses, and really communicate what I see on a day-to-day basis. And New York City is such a diverse place filled with people from different backgrounds, and I like to reflect that in my work. So coming to Jacobi, I wanted to not only just take the notes that I received from the actual staff, from patients, to create the overall composition. So the people are faceless, because I want people to see themselves in the work, and learning such a diverse community that Jacobi supports. I didn't want to just focus on one group of people, but I wanted to create something that had a warm and inviting palette that people could see themselves and their families in through multiple generations. And as Nick said too, with the color palette and getting feedback from staff, from patients, and seeing how the room looked as is, and having those like muted colors already available, I wanted to put that in the work, because I thought it was important to add to the space, but not feel like I'm trying to push any particular agenda, but wanted something that already seemed like it went with the hospital.
You know, the notion that Nick talked about, the notion of people participating. Now, let's be real. You're an artist. You conceive of things. You want to create something. Was it difficult? Did it make it easier because they had so many suggestions, or were you like, all right, enough, enough already? I want to just paint this thing.
No.
Tell me about that process, which I think is so important. It's what Monica was talking about collaboration, and everybody feels good about it. But go ahead, answer my question, please.
From my perspective, it was a seamless process.
Seamless.
Yes, because we came up with a Google form. So even the people that weren't available at the focus group, they had the opportunity to fill out that Google form to share their opinion. So it was not about getting every detail into the composition, but more like the overall recurring themes of the ideas that people had. So not just putting like, okay, these particular groups of people are service or live in the neighborhood. It's like, okay, adding people, but it not being so specific to ethnicity or race, but also wanted to create an idea that still communicated diversity without being so literal in the process.
Could Anderson, if you could just put that up again, I want to note some things. Obviously, the note, and I think it's fascinating, because when you look at it, there's so much in there. You know, the each figure represents different cultures. But notice the other thing is it looks like a person pushing somebody in a wheelchair. That could be a caregiver of some sort. There are people who are at all different levels. You can see doctors and nurses and other people really identifying a community straight ahead in the middle. I guess it's a guy with a green shirt holding a child. I mean, there's really a lot in there. When you look at it, Nick, what strikes you? What makes you say, "Yeah, this is what we need here at Jacobi Medical Center"?
I think it's cool because I think it's like a slice of a day in the life. Like that is what often the lunch area looks like, or even the day, because our office is pretty much right next to the mural. So all day I get to see kind of the people going through, and it looks very much like the mural looks, where there are people in wheelchairs, there are people with children, there are doctors, nurses, people together.
And
People eating.
caregivers, for example.
Mhm.
Before we run out of time, Monica, all the way on the right side, I noticed there, and this was something I think that was important to Jacobi, was the fruit basket. So the idea that healthy food is, of course, important in everybody's rehabilitation, whether they're in the hospital or they're working at the hospital or not. That kind of thing must be really rewarding for you about
And
art
it's
and health.
absolutely, and it's actually taken from Ebony's research, where Ebony, if you want to describe what you did, but walked around the hospital and sketched what was happening. And there was a farmer's market here, and I'll hand it over to you, Ebony.
Okay, we got just about a minute, so Ebony, go to it. We'll give you the final word on, let's talk about using the mural to make people healthy.
Yes, there is an internal store. Nick, I don't know the specific name, but there it services a lot of the community there, where they get like fresh juices and smoothies and fruits that you can buy there, and also amazing barber who took me on a tour around the hospital, where they show that there's farmers markets and food trucks in front of the hospital, where it's a combination of not just people healing and the doctors assisting, but also using food as medicine. And I wanted to convey that in the artwork without, again,
Wow.
being so literal, but just wanting to communicate that as well.
Absolutely fascinating, and to me, there's so much here, Monica. The research that will show what artwork can do is vital. And Nick, where is it in Jacobi Medical Center, so that people who want to see it in person can do that?
It's on the first floor in building 1. As you walk, you can get to it either through the building 8 entrance or the building 6 entrance. It's kind of like in the middle between the two. And very easy. Just walk straight through.
Come on by and see it and enjoy it and appreciate. I'm going to give the final word. Appreciate all the things that go into making people healthier. It's not just getting the needle in the arm and getting wheeled into the operating room. It's also a lot about culture and about what's up here. So Nick Hughes, thank you so much. Monica Moreno, thank you so much. And Ebony Bolt, thank you so much, because this really creates real community in the Bronx and in Jacobi Medical Center. Thank you for joining us. Okay, folks, that will do it for the Bronx Buzz for this evening. Just again, a reminder, we're moving to Fridays at 6:30 p.m. And other than that, what a great show. What fun it is to just talk to people doing great stuff in the Bronx. And so, if the curtain don't fall and the creek don't rise, we'll be back next week. That's what we do. Good night.